Hi, I'm Dr. Dan Sindelar, current president of the American Academy for Oral Systemic Health, and we are at our third annual scientific session out here in Las Vegas. And we're having presentations that are really changing the whole area of oral health in relations to overall health. And I'm here with Dr. Garth Ehrlich, who is the director of the Center for Genomic Science, and he is one of the leading experts in the area of genetic testing, genomics, and research. He has written, I believe it's 250 papers, over 250 papers, yes. And just really giving us a lot of insight into the area of research in regards to biofilm and the like. So what do you find is the biggest paradigm shift going forward with your area of research?
I think the biggest paradigm shift is that many of the conditions that we used to think of as chronic inflammatory conditions are actually chronic bacterial infections. And the reason that we didn't recognize them as bacterial infections is because when bacteria adopt a sessile mode of growth, termed a biofilm, they're very difficult to culture, and they are highly resistant to antibiotic therapy. And so the belief developed in the medical and dental communities that these conditions, which couldn't be treated with antibiotics and where they couldn't detect bacteria, must have been inflammatory conditions as opposed to infectious conditions. We've been showing over the past quarter of a century in one after another of the clinical fields, starting first with ENT, then going to orthopedics, and now into periodontology, that these inflammatory conditions are actually chronic infectious conditions caused by bacterial biofilms.
That's just unbelievable how far this is advancing in such a short period of time. Do you find the tools we have, or that you have available to you, are changing the way we look at all of our research from the past?
Absolutely. I mean, all of the discoveries that we have made have been by being early adopters of new technologies. And so how you think about a problem is directly related to the tools you have at hand. And so it's very critical that if you're dealing in an area of science or medicine where there's a paradox, that you bring the most advanced tools to play to try to solve that paradox. And so most recently, we've been working with this new molecular diagnostic technology, which means it's DNA-based, that allows us to find what we call the microbial dark matter. Because the vast majority of bacteria, as I was saying, are unculturable, maybe 20% or less. So that means 80% of the bacteria you can't culture. So by adopting these second generation molecular diagnostics, which not only can detect any bacteria, but speciate that bacteria, regardless of whether it's culturable or not, allows us to look at any condition and determine whether there are bacteria present and what bacteria are present. And so when you're no longer under the burden of having to guess what to look for, amazing things come out.
That's fantastic. With our academy, our purpose is to raise awareness, and we are just constantly having all of this new research, and experts like Dr. Ehrlich are the ones that are bringing this to us, and it opens our eyes. In the past, it was like walking around in a dark room trying to find out what the right way was, and if you can't identify things, it's really difficult to really understand. And I commend you on the excellent work you're doing and being able to find and see things so that we know what direction to go in. Do you see any specific area in oral health in the future that you're going to be looking into that sounds of interest to you?
Well, Dan, thanks for the opportunity to address that question. So yes, there's one overriding question that we're very interested in right now, and that is the role that periodontal pathogens play in the development of infections of the joint, and not just artificial joints, but in joints that have osteoarthritis. We have preliminary findings to suggest that periodontal pathogens are associated with joints with osteoarthritis. So does that mean that the periodontal pathogens are playing a causative role or an exacerbatory role in osteoarthritis? If that turns out to be the case, that will be revolutionary.
Oh, I agree. Well, I love the way you approach things, and you had a quote about science. What was that quote?
Yeah, so I never found a scientific problem I wasn't interested in.
And
I'm a curious guy.
And that's the juice to where we're going with all this, is to write or ask the right questions. And hearing you present, I hear you ask the right questions, and then you find the answers. And that's how we're going to push this out so far forward. So I am very honored to have you as part of our presentation, and I thank you very much.
Well, thank you, Dan. It's been wonderful to be here with the vanguard of individuals who are concerned about the overall health of individuals.